Another big story we're tracking for. U.S. Health Minister Dr. Zweli Mkhize warns of a COVID-19 peak. In fact, he says we're in the middle of a COVID-19 storm. South Africa is running low on critical care beds and oxygen needed to cope with the surge in patients. Now, the government's ventilation project aims to manufacture 20,000 ventilators locally by the end of September. The South African Radio Astronomy Observatory is not just focusing on the telescope and the SKA, but has now also been mandated to manage the production of ventilators. Let's get you an update on where this project is at. We're joined now by project manager of that project, Willem Esterhuyse. Willem, thanks very much for your time this morning. These are not two things we want to hear in the same sentence, that we're in the middle of a COVID-19 storm and we're running low on ventilators and oxygen.
Yeah, that is obviously not two things that you want to hear in the same sentence. But we are working very hard on addressing that problem, and fortunately we did start on that quite a while ago. At the end of March, and there was some development work that needed to be done, but we are actually quite well on track to address that problem.
Willem, did we get going too late with this national ventilator project?
Well, we started, when the request came through from the Department of Trade, Industry and Competition. I think that's the first thing. And I think there might be a misconception as to the amount of work that has happened. One of the worst things that you can do when you're in a crisis like this is to start running off in the wrong direction and start doing things just for the sake of doing things. As many people always say, is that you shouldn't confuse action with progress. So the first thing that we did, we're following a system engineering process. So the first thing what we did was to define, what is the real need. And back in March, the so-called CPAP devices that essentially just provides oxygen at a constant pressure to a patient wasn't necessarily seen as the best option. But, we spent quite a bit of time with clinicians to come up with what is it that's really required and what is it that's going to have the biggest impact on treating patients. So, we drew up a specification, then we went out on a call for proposals. We got some really good companies to develop prototypes. We had those prototypes tested against that specification. We went through the whole process of getting those prototypes SAPRA approved, because without your health regulatory body approval, you cannot deploy these devices to hospitals. And then, of course, we had to get the funding to actually place production contracts. So the first production contract has been placed now, and that's running. And we should have the first 2,000 ventilators by the end of this month and 10,000 ventilators by the end of August. So that is the schedule that we're working to. Then in parallel to that, we had people working on the modeling side to predict what's going to happen in terms of the numbers. And then obviously they're tracking those numbers, the reality versus what was predicted. Just to make sure that we are on the right track. And I think one thing that people need to understand is that 2 months ago, you had to make decisions based on incomplete information. And the only thing that you can do then is to update that all the time as you go along. And, looking at it now, I really think we've done just about as well as we could have.
Yeah. So, as we look at some of the positive aspects of COVID-19 amid all of the grim news that we are tracking in light of the pandemic, this is no small achievement for South Africa, is it? Just because we don't really have a history of manufacturing medical equipment in the country.
Yeah, and the thing that I always say is that once you have translated your requirement, be it a radio astronomy requirement or medical requirement, once you've translated that into engineering terms, then all you need is a good engineer to solve that problem. And, I really was pleasantly surprised, one, by the effort that my own team has put in. I mean, the guys and ladies worked over all the long weekends, day and night, literally. And you know, the engineering competence in the country is fantastic. We went out on a call for proposals. We got 95 proposals, and we developed 5 prototypes that really is very, you know, good products. Yeah. And one of the reasons that we had to do this, you know, if you look at traditional ventilators, then those things are very expensive. You know, they're in the order of 100,000 rand a unit. So, I mean, you can just imagine if you need 10,000 ventilators at 100,000 rand a ventilator, it's going to be a hard sell to get R1 billion funding from somewhere to actually build those things. Getting 100 million rand is a lot easier. I can promise you that. And, you know, we have now secured that funding from the Solidarity Fund, you know, so they've been great in assisting on that. So the production is going forward. And then, you know, in terms of addressing the oxygen supply and so forth, you know, we are engaging with the Department of Health, you know, at national and at provincial level. You know, we're making sure that they understand what is the requirement in terms of the oxygen usage of these things, because sometimes there's a misconception as to the amount of oxygen that our devices will be using. You know, they can use higher 60 liters per minute, but they can operate perfectly well on between 15 and 20 liters per minute. If you go over that level, then quite likely you need to go up to invasive ventilation. So, you know, we're just making sure that they understand that, and we're working with a team that's looking at the oxygen infrastructure to make sure that that will be adequate.
Yeah. So, Willem, as we, like I was saying, try to look at the positive sides of these grim stories, is this a new opportunity now for South Africa as we start to map in our minds post-COVID-19 and what our economy will look like?
Yeah, it is most definitely an opportunity as well. And I know that the Department of Trade, Industry and Competition is definitely looking at it in that way. And I mean, that's what they do. So if they don't do that, to be honest, I would have been a little bit disappointed, right? So, you know, if you look at these devices, it really is very solid devices. We've got SAPRA approval, be it the Section 21 approval. That means that it's valid for usage in a pandemic environment. But the intention is to, during this period, to go for full certification so that these can actually remain in hospitals afterwards, for one, but then also that you can produce these for, you know, just standard run-of-the-mill operations. Yeah. So there's definitely an intention to, you know, try and create new industry and new manufacturing opportunities out of this.
So as we end off our interview, Willem, just give us a reminder of those numbers again. How many ventilators we'll have by the end of July, and then what are the increases in the number of ventilators we'll have throwing forward to the end of September?
So at the moment, for the public sector, we're looking at 2,000 units by the end of July, 10,000 units early in September. And then we're also playing matchmaking for, you know, some of the people that's developed ventilators with private healthcare. So there will be some units there as well. I haven't actually got that numbers at the moment. But, you know, so contracted at the moment is 10,000, and that will quite likely increase to 20,000 in the near future.
Well, all the best with this incredibly important work you and the team there are doing. That's Willem Esterhuyse. He is project manager of the National Ventilator Project. Those numbers are encouraging as we look at just how many ventilators will be produced in the coming weeks and months.